Adelle, how did you first become interested in nutrition?
Actually, I came indirectly because I lived on an Indiana farm as a kid. And from the time I was 10 until 18, I was very, very active in 4-H clubs. And as a result of this 4-H club work, we had a lot of roundups at Purdue University. And so I got very fond. All of my sisters had gone to Indiana University, and the only thing they taught at Purdue was home economics. So I started out at Purdue at home economics. Then I went on and got my hospital training in New York City as a dietitian. And I was very disillusioned by that because I was all full of idealism and how we could make people healthy with good nutrition. And the diets were just horrible. We fed people on 19 cents a day. If they got a gun in their hands, they could have shot us, I'm sure. But we didn't see the people. And so I didn't like that. I liked people too much.
Adelle, I would say that nutrition is taken pretty much for granted in America. Why?
I'm not sure nutrition's taken for granted. The uninformed person will think that if they're not hungry, they're well nourished. Mm-hmm. I think that's perhaps what you mean. Unfortunately, that isn't true. We have just an appalling amount of sickness in America now. We have millions of people have heart disease, millions have arthritis, 22 million have allergies, and there are so many millions of people with diseases. They've either got bad eyes, or we've got brain damage, or we have mentally defective so that they're in hospitals. There's a tremendous number of people in hospital beds, you know, even though they're putting people out on tranquilizers in hospital beds because of mental illness, which is turning out more and more and more to be a nutritional thing.
How much of that sickness would you say is nutritional?
I think that a very great deal of sickness is because of the refined foods. I think we're literally at the mercy of the unethical food, refined food people, the people who take all the minerals and vitamins out of the sugar, out of the flour, make hydrogenated fats rather than leave the natural good fats.
Are pediatricians and obstetricians trained in nutrition?
Some of the medical schools are beginning to give some work in nutrition, but none of it's adequate. Most of them have, but the tragedy is that they have such terrific power over the girls and over the women and the babies. For instance, I have yet to know a baby, unless it's nursed, who's on a good diet. I've never known a formula to be adequate.
You've written another book on disease and health, Let's Get Well.
Yes.
Can you really avoid disease through good nutrition?
Some you can and some you can't. A great deal of, there's been much interesting work in the past in which native races who had no refined foods whatsoever have been investigated, and they found that there was tremendously good health. There was no heart disease, no cancer, no diabetes, no gallbladder disease, no mental disease, no crime, no drugs, no alcoholism, and so on. And apparently, if our food were good, but our nutrients needed to build good health are being thrown away.
Why do you feel that most of the American public doesn't eat that way?
Because we've heard years and years and years of propaganda. We've been told that certain cereals build champions when it did not. You feed it to rats and they die, any of the cold cereals. We've been told that white bread builds strong bodies so many ways. Dr. Roger Williams took 10 or 12 different types of white bread, all so-called enriched, and fed it to rats. They all died in about 6 weeks, or almost all of them died. And he brought out that that time was when prisoners would be kept on bread and they thrived.
Adelle, what's your recommendation for adult consumption of milk?
Well, I think adults would be much healthier if they had a whole quart of milk a day. For instance, there's something like 6 million women with aching backs because their bones have been demineralized. Milk is one of your best sources of protein. I like to recommend at least a quart of milk a day to everybody. And it's the only good source of calcium. It's an excellent source of B2, which is an extremely important vitamin, I think.
But we've been told that milk is also a source of cholesterol, which is supposedly dangerous to the health.
Well, the cholesterol problem is there's a lot of misinformation on that, of course. And by physicians, again, because they haven't been trained in nutrition. Cholesterol is high only when the foods are so refined that we haven't the nutrients to utilize it well.
Are there any general rules that you can throw out to the public for keeping themselves healthy with good nutrition?
Yes, I gave that in quite a good deal of detail a while ago. Just natural foods. Whole grain bread, cereals, fruits, vegetables, milk, cheese, eggs.
It's that simple?
Yeah, it's that simple. There's nothing refined if you really want to build health.